One of the things that we are striving to achieve in the clinically integrated network is the triple aim. The triple aim is a phrase that was coined by Donald Berwick when he was the interim director of the CMS. It basically is a term that refers to the pursuit of improving patient experience of care, improving the health of the populations that we serve, and reducing the per capita cost of health care. There's basically a triple aim in that, and there's also one that we have added on with the triple aim, the fourth leg of the stool per se, which would be people. And we want to look at the resilience of the physicians and providers within the network.
So as we think about the triple aim, one of the questions is, why the triple aim? What are you trying to do? What is the point of the triple aim? And we're going to be looking at the three, in fact, four legs, as Dr. Willardsen mentioned, of the triple aim plus people, to look at exactly why we're trying to pull a number of institutions together and begin to work together towards the triple aim.
The triple aim is basically a framework that gives us the basic challenge of what we're trying to do within the network, and it describes the approach to health system performance. If we can improve the health and quality of the patient, if we can improve the experience of the patient while looking at the financial aspects of what we're doing, this gives us a framework of what to strive for within the network.
And all in the context of making sure that our providers and our staff don't get overworked in that process, so the plus people. So first off, as we talk about the triple aim, the first leg that we might discuss is talking about the patient experience, the patient care experience. We're talking here about how the patient experiences their journey through healthcare, as well as the quality that comes to that individual as a part of the healthcare delivery process. So we're looking at ways to improve how the patient experiences their care and the ultimate quality that they experience as a result of their care.
So that leads us into the second leg of the stool, which would be the improved healthcare of the population. This has always been the goal of healthcare, is to improve the health, the general health of the population. We've always been quite adaptive and very good at treating the patient when they're ill. What we have stumbled on many times is keeping the patient from getting ill. And so one of the big aims of the triple aim is to improve the health of the population, preventing them from getting these chronic diseases and preventing them from getting the ailments that will haunt them later on in life. And we want to do this across the community, across central Minnesota, and that is one of the big aims of the clinically integrated network, is to pull the healthcare organizations together to coordinate the care to improve the health of the whole population in Minnesota.
And then the third leg, and very important leg of the triple aim, is to reduce the per capita cost of healthcare. We talk a lot about the very high spend that we have here in the United States for healthcare that's not necessarily of better quality than comparative countries elsewhere. So we want to look for ways to give better quality care for less dollars per capita per year.
So when we look at the triple aim, we also have to, as we've mentioned before, look at the people that are supporting this triple aim. There's the caregivers, there's the patients, there's the social determinants within the whole context of the organizations. All of these parts have to work together to achieve the triple aim. And when you look at all these parts moving, they're very important. The people aspect, the human resources of everything that has to happen. As we've always said, medicine is changing, and medicine has changed and will continue to change, but the pace of change seems to have quickened of recent, and we have to be very careful that we don't burn people out in all of these initiatives that we continue to try to do the triple aims.